Hi, my name's Dr. Pav Hare. I'm a GP here at Midland Health. I like to call them health habits. I suggest that we stay active, we stay hydrated, and we stay happy. It's really good to try and get into a habit of including exercise into your lifestyle. And we recommend 30 minutes of moderate intensity exercise 4 to 5 days a week. Okay, something that you enjoy doing. This might not be possible for all patients, so I do recommend starting slowly and to be kind to yourself, because it does take time to adjust and adapt your lifestyle. For example, if you enjoy walking, I could suggest perhaps going for a longer walk or a faster walk. You could also wear a weighted jacket or a weighted vest, which can really make a difference to your exercise output as well. My next health habit is to stay hydrated. So I always recommend trying to keep a bottle with you wherever you go and keep sipping throughout the day. Even if you're not feeling thirsty, take a sip of water, okay? We aim for about 2 litres of water per day. And if you can't drink water, you can add some squash or cordial to the bottle, as long as you're avoiding any heavy caffeinated or fizzy drinks. A way of assessing whether you're having enough water is to look at the colour of your pee. It should be a light yellow colour. If it's a little bit dark or straw coloured, it just means that you need to drink perhaps a little bit more. So ways that you can help regulate your own mental health is to recognise any triggers that could be affecting your mood, perhaps making you upset, stressed or angry, and just taking a moment to maybe take yourself away from those stressful moments and triggers, and go and do something that you enjoy doing, and spend time with your friends and family, read a book, have a bath, have a slice of cake, anything that makes you feel happy, I would encourage. And another health habit that I would encourage is to look at your sleep hygiene. So having 7 to 9 hours of sleep each night is recommended. And to do this, we need to look at your environment where you're sleeping and the habit of going to bed. So we advise avoiding any screen time or tablets at least an hour before bed. It helps you unwind. Research has also shown in the colder months, if you have warm feet, it helps you fall asleep faster and gives you a better quality sleep. So perhaps some fluffy socks or a hot water bottle with you in bed would be good. I also recommend either drinking chamomile tea or spraying lavender oil on your pillow. These can all help to have a better quality sleep as well. Before you fly out, I'd recommend making an appointment with your GP here at Midland Health to talk about your destination, where you're going. Do we need to think about any vaccines? What type of activities will you be going? Will you be in remote areas and travelling through swamps and jungles, or will you be only in built-up areas like cities and hotels? That will help us decide which travel vaccines are recommended for you to keep you safe, but also your family and children as well. We'd also think about malaria prophylaxis. Do you need any malaria protection? And if so, for how long? That's something we can help you with here at Midland Health. Taking a first aid kit with you. And in there, I would have the basics. So any simple painkillers, some plasters, bandages, antiseptic wipes. So it's always important to travel with that, so you've got it at hand if you need it. I would also recommend that when you are travelling, to stay hydrated. It's very, very easy to become dehydrated when travelling. So when you pass through security in duty free, buy that big bottle of water, keep it with you, keep hydrated on the plane as well. Another hack is to sample the local yogurt of the destination where you're going, because that's just going to help regulate your gut health and keep you happy while you're there. If you are by the pool or the beach, I'd recommend changing your swimwear every day, and avoid sitting in soggy swimwear for too long, because this can cause skin irritation and cause fungal infections, which we want to try and avoid. I'd also recommend staying protected from the sun. That includes making sure you've got your sun cream on, making sure yourself and your children are avoiding the sun during the peak hours of around noontime, wearing sun hats, long sleeves if you need to, and also thinking about after sun. So after you've been in the sun, applying that will help keep your skin safe as well. It's really good to prepare cards in advance so that you can use them in an emergency to say, I need help, I'm having a reaction, or can you please call an ambulance? Those can be life-saving in some certain situations. We're always happy to see you here at Midland Health for any of your health problems. If you are interested in coming to speak to one of our GPs, please contact reception, give us a call, or you can drop us an email to book your appointment. Thank you.